All right, Doc, we got a couple of questions here that I'm going to run through pretty quick. So, for those of you with dental insurance, you know most dental insurances have preventive coverage. So, Doc, real quick, what would be considered preventative type of things we do in the office that are covered under that preventative coverage?
Sure. Most people that have dental insurance, preventive services will be covered 100%. Now, the preventive services would be an exam, just to get me to look in there, and also with any of our auxiliaries to look in there. No charge for that, we don't think. Now, I was talking to Barbara O'Brien earlier today. I was trying to get her to come on and be on the show with us, but I couldn't do it. Barbara, you're sure you don't want to come back and do it? No, she's saying no. So Barbara's not going to do it. That's her phone that keeps going off back there. So, but I did talk to Barbara, and the exam is covered. The X-rays are generally covered. And the cleaning, depending on what type of cleaning you have to have. If you haven't been to a dentist in years, you may need a more extensive cleaning. We would have to ask the insurance company about that. But just for routine stuff, that's generally covered 100%.
Okay, so next would be insurance companies with their co-pays for cleanings and X-rays. Different companies, I will say this, sometimes they allow for X-rays twice a year, sometimes every 6 months, with no deductibles and no co-pays. So
she did say something.
Yeah, so that's really good and part of that preventative plan.
Okay, so she said there's no co-pays for. Tell me again what
for the cleaning and X-ray, right. As long as we do it on that 2-year or every 6 months, depending on which company requires.
Which company? Yeah, no copay, and you come in and get it. It's a great service. If you have dental insurance, you're crazy if you don't use it. I know a lot of people hate going to the dentist to say, only go if something hurts. But if you keep regular appointments, and I tell this to the hygienist too, you could put the dentist out of business if you did exactly what we tell you to do, and you came every 6 months. And you're good about flossing and brushing, you could cut out a lot of the stuff that I do.
Right, and so now there's several different X-rays when you come into the office, and people will ask us all the time, what's the difference between this X-ray and that X-ray? So a couple of the common X-rays that we'll do here in the office are what are called bite wings. So Doc, what's a bite wing?
A bite wing film. It's a series of 4 X-rays that we take, and the reason why we call it bite wing is because the patient will kind of close into a little tab that we have on it in order to keep it parallel. You want to cut right through the contact of the teeth at a 90-degree angle, so it just kind of keeps it flush like that. And the bite wings are for detecting caries, detecting cavities. Right. And that's why we use that.
Okay, and so bite wings, Doc will use those a lot. Like you said, series of 4. He can look at that and identify different cavities, locations, lets him see between the teeth to identify the cavities that are between teeth. What about a Panorex?
Panorex is a great tool. A Panorex, it goes from ear to ear. It will swing all the way around and gives us a nice view of the entire head. And from that, we can see the sinuses. We can see the jaw bones. We can see the loss of bone. We can tell. We're talking about the implants. So you have to have one of those in order to see how much bone that you have, and whether or not the bone is dense. The angle of the roots, if we have to take teeth out, and there again, it's a great benefit. And if you're not covered, if your insurance doesn't cover that, and you're a regular patient, I give those away too, just because it makes me sleep better at night, knowing I haven't missed anything. It's a good film to have. I kind of use the analogy that it's sort of like having a mammogram in your mouth. It can detect problems before they occur, and if we can see it, statistically, about 1 out of 200 people have something wrong that should be taken care of before it gets to be a big trouble. And if you think about how many patients we see, if we see 40 or 50 a week, once a month there's something in there that we should have found, and that's why we do that. Right.
And one of the other ones that we most commonly use would be the PA. So can you explain why we do the PA? Because a lot of times you'll come into the office and we'll do a set of bite wings and take those 4 pictures, but then we'll come in and take a PA, and people question us, well, you just took pictures of those teeth. Why do you need to take another one?
Yeah, we get that all the time too. Now, a PA stands for periapical. Periapical means peri's around. Apical means around the apex of the tooth, which is the tip of the tooth. So whenever we take a periapical, we want to go at least 2 millimeters beyond the apex of the tooth, or the tip of the root. That's the way we can tell if the tooth is salvageable, tell if we're not wasting our time. If we went in there and just didn't take a PA of a tooth, and you say, I need a crown on it, and we go cut the crown and get the crown back, and then 6 months later the tooth starts hurting, well, we should have taken an x-ray to make sure that the tooth was sound, because we never crowned good teeth, so there's something wrong with that tooth in order for us to tell you that you need a cap or a crown on it. So just a silly little x-ray will show us real quick.
Great. And real quick, going back to your insurance, I want to remind everybody, if you are one of those insurance carriers, most insurance companies, and they vary a little bit from company to company, but you usually have about $1,000 a year max. That goes up with some companies, a little lower with other companies, but we want you to keep that in mind, because if you have that in a year, it's like Doc was saying, if you have the insurance, you really should use it even for preventative things like that, and keep your health up. One of the other things with your insurance that we end up dealing with, and people, they come in, their tooth hurts, they need a crown, or they need something, they want it right away. And a lot of times we do what's called a PTE. So Doc, what exactly is a PTE, and why do we need to wait for that to come back before we can do some things?
Sure. That's kind of a pet peeve of mine, and Barbara can attest to that. Barbara, she'll come to me and ask me to do an estimate, a PTE is what we call it, but it's a pre-treatment estimate, and all that is we're asking the insurance company for permission to do the work. Now, it is rare that we're turned down, but the insurance companies do like us to do it. Barbara likes us to do it just because she has it in order, and it's done in a timely manner, and she doesn't have to worry about it. I don't like them, because if somebody's here and we got something to do on them, I want to go ahead and get it, because I don't want to wait around. A lot of times the patient doesn't want to wait. I kind of say it's sort of like going to the emergency room and you've got a broken leg, and you got to call the insurance company to see if they can set the broken leg. If you got a broken tooth, it's nonsensical for us to think that we have to call the insurance company and get permission on it. If you're covered, and we know you're covered, but it's kind of the rules, and I try to play by the rules. But a lot of times I'll push it. I've been known to push it, but I'm trying to do better on that.
Well, and the other thing that helps us with is, a lot of people don't track, okay, I've been to the dentist 5 times this year, and I've had this work and this work and this work, and they may not know where they are with that $1,000 threshold. So that PTE helps Barbara and the office here establish just where we are on your threshold as well.
Exactly. And it generally is a calendar year from January to December. So if you got a tooth that's broken and it's November, yeah, sometimes we do have to wait to January. That's just part of it. So, but we can generally do something, or put a temporary on it until your insurance kicks in. But we can work with you on that. So it's not a problem.
So those are a lot of the questions that we get from our patients who come into the office for something that's hurting them or bothering them. Hopefully that answers some of your questions out there as you're thinking about, should I go, should I not go to the dentist? If you're having that discussion with yourself, I'm sure Doc would agree, the right choice is to go to the dentist. It's better to catch it early before you're in a lot of pain, before something happens that makes it worse and you're in a lot of pain, and maybe even having to lose a tooth that could have been saved if you made the decision earlier. So Doc, anything else you'd like to add before we...
School's about to start, so don't forget, you need to get in those habits. You need to get good hygiene habits. Make sure your kids brush their teeth before they go to school. Make sure you brush your teeth. The most important time is before you go to sleep. Now, when I was a kid growing up, it was 4 times a day. Now the recommendations have dropped down to 2 because people weren't doing it and they were getting overwhelmed. You need to brush your teeth at least twice a day. I had a kid come in, he was here today, and we told him he better brush his teeth 10 times a day or he's going to lose his teeth. The poor boy, he was 14 years old, but we got to stop it. It's very common. So brush those teeth.
Yeah, and I'll just add, helping doc with these patients. If you're a Mountain Dew drinker, brush 3 to 4 times a day. We have a little thing that we call Mountain Dew mouth, and Mountain Dew, for some reason, I don't know what it is about it, but it tends to really attack your teeth and the dentin on them, and really causes them to rot quicker than normal. So, and if you're a brace wearer, just another friendly reminder: as you're getting into school, put a toothbrush in that backpack. You need to be brushing 3-4 times a day with those braces, because like Doc will tell you, that food will get around there during the school day, and you don't want to get cavities just because you're wearing braces. So, anything else, Doc, before we let him go?
So it must be about 2 o'clock. Everybody's coming in, so we better get to work.
All right. Thanks for joining us today.